Let's get started.
Providing first aid means knowing how to recognize an illness or injury and deciding to act. It means getting involved and making a difference.
Providing proper first aid can save a life, prevent further illness or permanent injury, help with healing and recovery.
A first aid provider or first aider is someone who identifies an emergency situation and stays calm, takes charge and acts, calls emergency medical services or 911 if necessary, provides help until medical professionals take over. A first aid provider administers first aid to a casualty. A casualty is someone needing emergency medical care because of an injury or sudden illness.
Disease transmission.
In an emergency, some people may hesitate to act because they fear the threat of disease transmission associated with contact of bodily fluids. Infectious diseases range from the common cold to more serious diseases, such as HIV.
Infections occur when germs such as bacteria or viruses enter the body and affect one or more organs.
When administering first aid, the threat of disease transmission is minimal, and certain safety measures can help reduce the risk. A set of personal responsibilities called universal precautions can be used to prevent disease transmission.
These include wearing protective equipment, frequent and thorough hand washing, using gloves and breathing barriers when providing first aid, and avoiding contact with contaminated objects or materials that may puncture the skin. Gloves are an essential part of any first aid kit. Use gloves whenever possible while performing first aid. Gloves help to keep a barrier between you and potentially infectious bodily fluids. To correctly remove gloves, make sure you do not come into contact with the outer surface. Peel the first glove off from the wrist, turning it inside out. Bunch it into the palm of the opposite hand. To remove the second glove, grab it from the inside at the wrist and roll it off. Use a biohazard bag to dispose of any contaminated materials. Emergency scene management.
Emergency scene management is an effective plan that can guide your actions and ensure that you are providing the best care possible for an ill or injured person. There are 6 steps to follow.
Step 1. Survey the scene.
Once you recognize an emergency, take charge of the situation. Look for things around the scene that may threaten your own safety, such as fire, hazardous fumes, or live electrical wires. If your own safety is threatened, stay back and allow properly equipped and trained professionals to handle any dangerous situations.
Now that we've surveyed the scene, check for responsiveness. To check for responsiveness, gently tap the casualty and ask them if they're okay. If the casualty is conscious, identify yourself as a first aid provider and offer help. Obtain consent from them before providing care. If the casualty does not respond, assume they are unconscious and have someone call EMS or 911, or make the call yourself. It is important to monitor and note a casualty's level of consciousness. Any decline in the level of consciousness signifies that the casualty's condition is worsening. Step 3. Call EMS or 911 if needed.
If an injury appears serious or if the casualty is unconscious or unresponsive, alert EMS or 911 immediately. If possible, send a bystander to make the call and report back to you with confirmation that EMS personnel are on their way.
Step 4. Perform a primary survey.
Once you are confident that EMS or 911 has been called, you need to perform a primary survey. The primary survey is performed to check for conditions that may immediately threaten a person's life. This includes any problems with their airway, breathing, or circulation. This is called the ABCs of the primary survey. In the primary survey, confirm that the casualty has a clear and open airway and that they are breathing normally. Check for any circulation emergencies, such as deadly bleeding or shock, and look for any signs or symptoms of serious illness or injury. If the casualty is conscious and can speak, this is generally a good indication that the casualty has an open airway, is breathing, and has signs of blood circulation.
Step 5. Secondary survey.
The secondary survey can be performed once the casualty is breathing and has no life-threatening conditions requiring ongoing care. It allows you to check for less obvious problems that may require first aid. The secondary survey has 3 steps.
Assess the casualty's signs and symptoms. Ask about allergies, medications, past medical history, and events leading to the incident. Check the quality of the casualty's consciousness, breathing, skin color, and temperature. Examine the entire body starting at the casualty's head and look for any hidden injuries that may require first aid. Step 6. Ongoing casualty care.
Give the casualty the appropriate first aid, and once given, continue to monitor the casualty's airway, breathing, and circulation. The casualty's condition may worsen, making the situation life-threatening, so monitoring the ABCs is an important step in your ongoing casualty care. As you wait for EMS to arrive, have the casualty rest in the most comfortable position and calmly reassure them. Give them a blanket if you have not already done so. Keeping a casualty warm could help prevent them from going into shock. At some point, you will need to hand over the casualty to either another first aid provider, medical help, or if the situation is minor, allow the casualty to take control of the situation themselves. When contemplating handing over control of a scene, you need to be sure it is in the casualty's best interest. If you allow the casualty to take control, encourage them to be accompanied by either a friend, coworker, or family member if possible. If handing over the casualty to another first aid provider or to medical help, give them a detailed report of the situation, including the history, mechanism of injury, the casualty's signs and symptoms, and any first aid administered. Also, let them know if there are any changes in the casualty's condition.
Anaphylaxis.
An allergic reaction is a hypersensitive response to a common, usually harmless substance or allergen. An allergen can enter the body in 4 ways. It can be inhaled, absorbed, ingested, or injected.
Anaphylaxis is a severe allergic reaction commonly caused by insect bites or stings, certain foods, chemicals, drugs, or medications to which a person is allergic. Anaphylaxis is a life-threatening allergic reaction that can lead to serious respiratory distress. The throat muscles begin to swell, closing off the person's airway. Despite precautionary measures, a person may unintentionally come into contact with a substance to which they are allergic. An allergic reaction often occurs quite quickly and can be mild or can develop into a life-threatening situation. Signs and symptoms of anaphylaxis: a feeling or tightness in the chest and throat, swelling of the lips, face, neck, hands, and feet, rash, hives, or itching, wheezing when exhaling, nausea or vomiting, previous allergic episodes, weakness, dizziness, or confusion.
As soon as you realize that someone is experiencing a severe allergic reaction, call EMS or 911 immediately. Have the casualty rest in the most comfortable position and assist them with their prescribed medication. Epinephrine is a medication used to slow down the allergic reaction and will temporarily prevent the closing of the casualty's airway. If breathing becomes difficult for the casualty, help them to administer an epinephrine shot. An epinephrine shot is injected into the body with a needle and delivers a single dose of medication. The most popular product is called the EpiPen auto-injector and was designed for quick and simple use. The EpiPen auto-injector has a spring-activated needle and can be delivered through light clothing on the outer thigh.
Form a fist around the unit and pull off the blue safety cap. Hold the orange tip near the outer thigh. Swing and jab firmly against the outer thigh. Listen for the click and hold for 10 seconds.
After the injection, rest and reassure the casualty. Keep them warm while you wait for EMS to arrive. If signs of shock develop, place the casualty in the shock position and maintain normal body temperature. Call EMS or 911 if you haven't already done so. Continue to monitor consciousness and ABCs until EMS arrives. One shot of epinephrine lasts for only 15 to 20 minutes. If breathing difficulty returns and the casualty has another EpiPen auto-injector, help them to take another dose on the opposite outer thigh.
Preferably, seek medical advice before helping with a second injection. Asthma.
Asthma is a respiratory disease characterized by attacks that make breathing difficult. During an attack, the airway becomes extra sensitive to triggers such as stress, physical activity, temperature extremes, and allergic reactions to dust, pollen, or certain foods. When exposed to these triggers, the air passages narrow and become constricted, making it difficult to breathe.
Signs and symptoms of asthma. Breathing may be faster or slower than normal. The casualty feels like they are not taking in enough oxygen. The casualty may seem apprehensive or very anxious. Wheezing when exhaling. The casualty may feel dizziness and lightheaded.
Most people who have asthma carry medication in the form of a metered dose inhaler, also known as a puffer. Have the casualty give him or herself this medication. However, if the casualty is too weak, you may need to assist them. To help a casualty with their asthma medication, shake the container and remove the cap. Tell the casualty to breathe out all their air from their lungs. The canister can either be placed in the mouth or approximately 4 finger widths away. Have the casualty breathe in deeply while pressing the canister to release the medication. Have them hold their breath for 10 seconds. Be sure they take the appropriate dose found on the label of the inhaler. Encourage normal breathing. If the condition remains the same or gets worse, or if the casualty doesn't have their medication with them, call EMS or 911 immediately. Have the casualty stop what they are doing and have them rest in the most comfortable position. Assist the casualty to take any prescribed medication, such as an inhaler. Provide air by opening a window or having bystanders move back. Help the casualty maintain normal body temperature and provide reassurance to slow their breathing down.
Bleeding.
Bleeding is the escape of blood from the arteries, veins, and capillaries.
Veins are blood vessels that carry oxygen-poor blood to the heart. Venous bleeding is dark red in color and flows in a steady stream. Arteries are blood vessels that carry oxygen-rich blood away from the heart and are under high pressure. As a result, arterial bleeding is bright red and spurts out with each heartbeat.
Internal bleeding occurs inside the body and may be difficult to detect. External bleeding, however, is usually visible unless it occurs under clothing or a part of the body that is not visible. Uncontrolled bleeding of any kind can be life-threatening and may cause shock, so scanning the body for severe bleeding is an important step in your primary survey.
Major open wounds.
Whenever blood is present in an emergency, there is a risk of disease transmission. To avoid any direct contact, use a first aid kit that includes gloves, dressings, bandages, and antiseptics.
Have the casualty rest and apply direct pressure to the area with a sterile dressing or clean cloth to decrease bleeding. Use a bandage or tape to hold the dressing in place. Arterial bleeding. Bleeding from an artery is profuse and life-threatening. Since arterial blood is oxygenated, it appears bright red in color and will spurt to the beat of the heart. Therefore, it is imperative that we direct pressure immediately using bulky dressings, as severe bleeding can cause rapid shock and is more difficult to control. Special considerations for bleeding. Place additional dressings if original bandage becomes blood-soaked. Deep lacerations to the hands can sever nerves, tendons, and muscles. Control bleeding and wrap the entire hand to minimize movement. Seek medical attention. Major internal bleeding.
Deeper bleeding that is caused by a violent blunt force, punctures, or a fractured bone that ruptures a blood vessel can result in severe blood loss inside the body. Watch for signs and symptoms of shock, as well as bruising, blood coming out of the ears or nose, or blood that is coughed up or seen in vomit, stool, or urine.
Signs and symptoms of internal deadly bleeding. Discoloration or bruising of skin. Area appears tender, swollen, hard. Shock. Blood in saliva or vomit. Severe pain. If you suspect a severe injury has caused major internal bleeding, call EMS 911 immediately. Severe internal bleeding can cause the casualty to go into shock. Shock.
Shock is the failure of the circulatory system to provide enough oxygen-rich blood to all parts of the body. Shock is a common occurrence in many emergency situations. Shock can develop when an injury or illness causes circulatory problems. Circulatory problems are caused by loss of blood or bodily fluids, as in the case of internal or external bleeding, crush injuries, dehydration, and severe burns.
Signs and symptoms of shock. Changes in level of consciousness. Pale, cold, and clammy skin. Anxiety, restlessness, and confusion. Dizziness or feeling lightheaded. Irregular breathing. Excessive thirst. Nausea.
First aid for shock includes treating the cause. Treating the cause means controlling bleeding by directing pressure on a wound or removing a person who is sensitive to the sight of blood from an accident scene. Reassure the casualty and allow them to rest. Comfort the casualty to calm them and lower their heart rate. Loosen restrictive clothing and maintain normal body temperature. Continue to monitor and reassure the casualty until EMS arrives.
If the casualty is alert, place him or her on their back with their feet and legs slightly elevated. This is called the shock position. This position helps to encourage blood flow to the brain. Amputation.
When a body part is partially or completely cut off, this is called an amputation. First aid centers on controlling the bleeding and caring for the amputated tissue.
If a body part has been completely cut off, direct pressure to control the bleeding by using bulky dressings. Find the body part and wrap it in a sterile gauze or clean cloth. Place the wrapped body part in a plastic bag and keep it cool by placing it into another bag or container filled with ice. Attach a label to the bag containing the casualty's name and the date and time of the incident. Seek medical attention immediately because doctors may be able to reattach the body part. If a body part has been partially cut off, try to reposition the body part to its natural position and wrap it with dressings and bandages to control the bleeding. The dressings and bandages will keep the injury immobilized. Wounds.
A wound is a break in the skin or soft tissues characterized by the steady escape of blood, usually from an artery or vein.
Types of wounds include contusions or bruises, which is bleeding under the skin. Abrasions, which occur when the skin is rubbed or scraped away. Lacerations, which are cuts or tears in the skin and underlying tissue. Avulsions, which occur when a piece of skin is totally or partially torn away. And punctures, which occur when the skin is pierced with a pointed object. First aid for minor open wounds. In the case of minor wounds where there is only surface damage and little bleeding, wash the wound with soap and water. Disinfecting the area with an antibiotic will help prevent infection and speed the healing process. Infection is always a concern when an injury breaks the skin. After cleaning the wound, apply sterile dressings. For smaller wounds, use a simple adhesive bandage that can come in all different shapes and sizes. For larger wounds, use square sterile gauze pads and roller bandages.
Tetanus is a potentially fatal disease that may result if wounds are not thoroughly cleaned and disinfected. A deeper wound that is the result of an animal bite or occurs in unhygienic surroundings should be referred to medical help. Serious infections may cause the casualty to develop a fever. There may also be red streaks under the skin progressing from the wound. If this is the case, seek medical attention immediately.
First aid for infection. Keep area clean. Apply a warm, wet compress. Apply an antibiotic ointment recommended by a pharmacist. Seek medical attention if the infection looks serious. A doctor may prescribe appropriate antibiotics. Special considerations for wounds. When do we need stitches? Stitches are usually needed when there is a complete separation of both skin layers, the edges of the skin do not fall together, and the wound is larger than 1 to 2 centimeters. First aid for minor closed wounds.
A closed wound does not involve a break in the skin, and therefore no external bleeding. Signs and symptoms of a contusion or bruise include tenderness, discoloration, and swelling of the soft tissues in the area.
Direct pressure on the area to decrease bleeding under the skin. Apply a cold compress to control both pain and swelling. Applying a cold compress will also constrict the blood vessels in the soft tissue and minimize internal bleeding. Be sure to place a thin barrier between the cold source and the skin. Apply cold for 20 minutes every hour for as long as the person feels pain. If it is a more serious bruise, apply cold for 20 minutes every hour for the first 24 to 48 hours. Check and treat for any underlying bone, muscle, or joint injuries. Embedded object. If an object is embedded in the body, do not remove it. Removing the object can cause further damage and bleeding. Instead, use bulky dressings to support and stabilize the object as much as possible. The dressings will also apply pressure to control bleeding around the object. Wrap a bandage around the dressings and the object to hold everything in place. Confirm proper circulation below the injury. Treat the casualty for shock by placing them on their back with legs slightly elevated. Cover the casualty to maintain normal body temperature. Nosebleeds. Nosebleeds are common injuries usually caused by a blunt force. A common misconception is to tilt the head back to control bleeding, but this may drain the blood into the back of the throat and cause choking or vomiting. Instead, get the person to sit with their head slightly forward while pinching the nostrils for 10 to 15 minutes. Eye injury. Place the person on their back. Do not attempt to remove the object. Place sterile dressings around the object to help support the object in place. Secure the dressing with a bandage. If calling EMS, consider covering both eyes to help better stabilize the object. If there is a foreign body, such as sand, dust, or chemicals in the eye, flush the eye with water. If the object is chemical, flush continuously until EMS arrives. If possible, use an eye wash station in the workplace to help flush out the eyes. If flushing one eye only, position the affected eye downward so that the foreign object does not come into contact with the other eye. If transporting the person to the hospital, cover the affected eye with a sterile dressing and seek medical attention. If the object cannot be removed, cover the affected eye and have the person seek medical attention. Did you know? A knocked out tooth is best preserved in a closed container of milk until it reaches the dentist. Ideally, the tooth should be reimplanted within an hour of the injury. Burns.
A burn is a specific type of soft tissue injury caused by heat, chemicals, electricity, and radiation. Burns can cause swelling and breathing problems if they occur around the face or throat. Burns are easily susceptible to infection, and severe burns can lead to shock. Burns are classified by their deepness and severity and are separated into 3 categories: first degree, second degree, and third degree.
A first-degree burn damages only the top layer of skin. Signs and symptoms include dry skin that is pink or red, slight swelling, and tenderness to intense pain in the area. A second-degree burn damages both layers of the skin. The burned skin is raw and moist and ranges from white to red in color. Other signs and symptoms include blisters that may be open and leaking clear fluid, and severe pain. A third-degree burn damages both layers of the skin, the underlying tissues, and bone. Blood vessels, fat, muscle, and bone may be visible. The skin is dry and leathery and may be charred black or white. The casualty may not feel any pain because of nerve damage. When to call EMS for burns. The burn causes serious tissue damage and severe bleeding, which may lead to shock. The cause of the burn is a result of electricity, chemicals, or an explosion. The burn covers a large area of the body. The burn is around the casualty's airway. This can lead to breathing problems. The casualty has a serious medical condition such as diabetes. The casualty is under 2 or over 50 years old. The burn area is exposed to potentially infectious material. The burn has caused severe swelling that may be cutting off circulation. First aid for superficial burns. Cool the burn with water until the pain stops. This usually requires 10 to 15 minutes of continual cooling. Once you have cooled the burn with water, apply an antibiotic ointment suggested by a pharmacist. Cover the burn with a dry, non-stick sterile dressing to prevent infection. First aid for partial and full thickness burns. Immerse the burned area in cool water until the pain stops. Avoid using a forceful flow of water, as this may further damage and open the skin. If the burned area cannot be put in water, cover the burn with a cool, moist, sterile dressing or clean cloth. Once you've cooled the burn, cover the area with dry, non-stick, sterile dressings to keep out air and prevent infection. Electrical burns. Approach the person if there is no risk of electrocuting yourself. If there is any uncertainty, stay back and call 911. Electrical burns may be more serious than they appear. The electrical current can cause deep tissue damage and create an entrance and exit wound, and both should be treated as any other burn. However, more importantly, in cases of severe electrical shock, the heart's normal rhythm may be interrupted, causing cardiac arrest. Be prepared to do CPR. Sunburns. Sunburns are a common type of burn caused by radiation. Try to prevent sunburns by using sunblock and being conscious of overexposure to the sun. Sunburns can be painful, and you should apply the following first aid. Get the person out of the sun and pat the area with cool water until the pain stops. Apply ointments recommended by a pharmacist. Head and spinal injuries.
Head and spinal injuries can be life-threatening, and improper handling of a casualty with a head or spinal injury can cause long-term injury, disability, or death. Therefore, seeking immediate medical help is extremely important.
Head injuries can impact the brain. Brain tissues can be damaged when bleeding from a ruptured vessel causes pressure to build up in the skull. The spine is a strong, flexible column consisting of small bones called vertebrae and pads of cartilage called discs. Inside the spinal column is the spinal cord, which is responsible for the body's movement. Severe injuries to the vertebrae may move, squeeze, or cut the spinal cord. This can cause permanent paralysis or even death. Causes of head and spinal injuries: vehicle crashes, falls, diving in shallow water, sports injuries, improper lifting techniques. Prevention of head and spinal injuries: wear protective equipment, always wear a seatbelt. Take safety precautions to prevent falls, such as using handrails, secured rugs, and non-slip bathtub mats. Use ladders correctly. Never dive in shallow or unknown water.
A head or spinal injury should be suspected if the mechanism of injury suggests an impact or blunt force to the head, neck, or back. If a casualty is thought to have a head injury, you should also suspect the casualty has a spinal injury and vice versa. The history of the event can provide clues regarding the extent and nature of the injury. It is very important to understand the signs and symptoms of head and spinal injuries so you can better determine the seriousness of the injury before providing the appropriate first aid.
Signs and symptoms of head and spinal injuries: pain, pressure, and swelling in the head, neck, or back, numbness, tingling, or loss of feeling in fingers or toes, paralysis of any body part, unusual lumps on the head or spine, bruising of the head or spine, nausea or vomiting, persistent headache, convulsions, difficulty breathing, difficulty seeing, dizziness or loss of balance.
Proper first aid treatment can prevent possible head or spinal injury from becoming fatal or from causing permanent damage.
If the casualty is breathing, continue to immobilize the head and neck in the position you found them. Monitor consciousness and breathing. Serious head injuries can affect consciousness, and trauma to the upper body can paralyze chest nerves and muscles, causing difficulty with breathing. An injury to the head or spine can hinder the body's ability to regulate its temperature. Maintain normal body temperature to prevent or minimize shock. If the person is wearing a helmet, leave it on unless it makes it difficult to manage the person's airway and breathing.
The following section describes some types of specific head injuries.
Concussion.
The head lacks the padding provided by muscle and fat and can therefore be easily injured. A concussion can result from a blunt force to the head, causing a temporary disturbance of brain function. In most cases, the casualty loses consciousness for a few minutes with no permanent injury. The casualty may experience temporary memory loss, confusion, nausea, vomiting, and difficulty breathing. If the injury is serious, try to keep the casualty awake until EMS arrives. If you suspect that the casualty has also sustained a neck injury, give first aid for head and spinal injury as described earlier in this section.
Scalp injury. When treating for external bleeding on the scalp, apply light pressure to the area as there may be damage to the skull. For a bump or bruise on the head, apply an ice pack. Bone, muscle, and joint injuries.
The musculoskeletal system consists of bones, muscles, tendons, ligaments, and joints that make up the skeleton and muscles that surround it. Together, this system works to protect the vital organs while giving the body shape and stability. An injury to a muscle, bone, or joint is quite common, and they range from minor to severe. As a first aid provider, you are likely to encounter one. Although this type of injury is not usually life-threatening, it can cause pain, long-term aggravation, or disability.
Types of bone, muscle, and joint injuries include a fracture, which is a break, chip, or crack in the bone. Fractures can be open or closed. A closed fracture is when the skin over the fracture is not broken. An open fracture means the skin is broken and a wound is created by a protruding bone. A dislocation is a separation of a bone from a joint. A sprain is the tearing of ligaments at a joint. A strain, usually called a pulled muscle, is the stretching or tearing of muscle or tendon. Signs and symptoms of bone, muscle, and joint injuries. Pain or tenderness that worsens if the injury is moved. Swelling at the site of the injury. Inability to move or use the injured body part. Discoloration of the skin. Feeling or hearing the sound of bone snapping or grating. External bleeding. Protruding bone. Deformity. The injured area looks different from the uninjured area. Inadequate circulation to the extremity.
First aid is the same for all muscle, bone, and joint injuries. Keep the casualty as comfortable as possible and avoid causing any more pain. To perform first aid, remember the acronym RICE. R stands for rest, I stands for immobilize, C stands for cold, and E stands for elevate.
R. Rest.
Get the casualty to stop any further movement and help them to get into the most comfortable position without causing too much pain.
I. Immobilize.
As you wait for medical help to arrive, immobilize the injured area with your hands. Steady and support the injured body part in the position found. Often, the casualty will want to do this themselves. The purpose of immobilizing is to lessen pain, reduce the possibility of circulation loss or further bleeding, and to prevent any bones from penetrating the skin.
A splint is a device that keeps the injured body part in place. There are 3 types of splints: soft, rigid, and anatomic. Soft splints include towels, pillows, bandages, and slings. A rigid splint can be made from boards, metal strips, or folded newspapers and magazines. Finally, an anatomic splint is using a healthy body part to immobilize an injured area, like fingers or toes. Confirm proper circulation below the injured area by checking for skin temperature and color before and after splinting. Loosen the splint if the area becomes cold or discolored. If condition persists, call 911 immediately. C. Cold.
Apply ice, a chemical cold pack, or cloth soaked in cold water to decrease pain and swelling as soon as possible. Early treatment with cold compress will help constrict the blood vessels and minimize internal bleeding. When using an ice pack, protect the skin from freezing by placing a gauze or cloth between the ice and the skin.
Cool the affected area for 20 minutes every hour for the first 24 to 48 hours. E. Elevate.
You can also reduce pain and swelling in the affected area by elevating it. If possible, elevate the area above the level of the heart to slow the flow of blood. Do not elevate the body part if it causes the casualty to feel more pain. Give ongoing care until medical help arrives and takes over. Continue to monitor circulation below the injury and treat for shock. If medical attention is delayed or the injury is minor, immobilize the injury with a sling or splint before transporting the person to the hospital. Lower leg injury.
Place bandages underneath the injured body part. Place the splint on either side of the leg, covering the joints above and below the injury. Tie bandages to secure the splint in place. Pad a rigid splint to keep the body part in a natural position. You can also use soft splints, such as towels, blankets, and pillows.
Lower arm injury.
For lower arm injuries, pad a rigid splint to keep the body part in a natural position. Tie bandages to secure the splint in place.
Slings.
For upper body injuries, you can apply a sling. Place a triangular bandage underneath the injured arm. The top point of the triangle should be towards the injured elbow. Wrap bandage securely to support the injured body part. Tie both ends of the bandage behind the neck. Twist or pin excess bandage around the elbow. Make sure the sling covers the entire arm with fingers slightly exposed. For extra support, secure a broad transport bandage to stabilize the sling.
Medical emergencies. Some medical conditions can cause a person to become seriously ill or require immediate medical attention. In this section, we will look at the following medical emergencies: diabetic emergencies and convulsions or seizures.
Diabetic emergencies.
Diabetes is a chronic disease that has no cure. Individuals who have diabetes cannot produce the hormone insulin, or the insulin they do produce cannot be properly used to regulate blood sugar levels. Diabetics must exercise, carefully watch their diet, and must regulate their insulin and sugar levels daily.
Diabetic emergencies are caused by an imbalance of sugar and insulin levels in the body. Hyperglycemia is a condition whereby insulin levels are too low, causing blood sugar levels to be too high. This causes the blood to become more acidic and can lead to a diabetic coma. Hypoglycemia is the condition whereby insulin levels are too high, causing low levels of blood sugar. In this case, the brain does not receive enough sugar, and the person may lose consciousness.
Signs and symptoms of hyperglycemia: increased thirst, frequent urination, nausea and vomiting, rapid breathing,
decreased consciousness, acidic odor on breath. Signs and symptoms of hypoglycemia: headache, perspiration, dizziness or lightheadedness, confusion, difficulty speaking, feeling anxious or weak.
If the casualty is unconscious, look for a medical alert bracelet that may tell you something about the casualty's condition. If the casualty is conscious, ask them what is wrong and if you can assist them. Generally, diabetics will tell you what is wrong and what they need. If this is the case, help them take what is needed.
Jen, it's Tony. It's okay. I know first aid. What's wrong?
I'm diabetic.
You're diabetic? I'm gonna get you some sugar. Hold on.
If the casualty is confused about what is needed, the first aid for hypoglycemia and hyperglycemia is the same. Give the casualty food or fluids that contain sugar, such as fruit juices, non-diet soft drinks, or candy. If the casualty has prescribed medication, assist them in taking it. In cases where the casualty has low sugar, the extra sugar you give them will help. However, in cases where the casualty has too much sugar, the extra sugar will not cause any harm in the short term. If the casualty does not feel better within a few minutes of taking the sugar, call medical help if you have not already done so. Have the casualty rest in the most comfortable position and give ongoing care.
Convulsions.
A convulsion or seizure is the loss of body control caused by irregular electrical activity in the brain. Common causes are disease, injury, fever, and epilepsy, a disorder of the nervous system characterized by seizures. Although convulsions may look frightening, you should never try to restrain the casualty. Instead, first aid care centers on protecting the casualty from injury and managing their airway.
Signs and symptoms of an epileptic seizure: sudden loss of consciousness causing the casualty to fall, stiffening of the body, sudden uncontrollable shaking, irregular breathing, eyes may roll back, drooling from the mouth, grinding of teeth, loss of bladder control. Try to protect the casualty from further injury by clearing the area of objects. Place a cushion or something soft under the casualty's head to protect it. Once the casualty has stopped convulsing, monitor ABCs and provide any first aid that is required.
Contrary to popular belief, you should never attempt to place an object between the casualty's teeth, as there is little chance that they will bite their cheek or tongue hard enough to cause severe bleeding.
If the casualty is unconscious, place them into the recovery position and wipe away any fluids from the mouth and nose. Do not restrain the casualty by holding them down. Loosen constrictive clothing at the neck and chest. Since the casualty may feel embarrassed afterwards, you should provide space and privacy for the casualty if possible.
If you know the casualty has epilepsy, you do not need to call EMS. However, you should call EMS for any of the following cases. The casualty fails to regain consciousness. The casualty has repeated convulsions within a few minutes. The cause of the convulsion is uncertain.
Febrile convulsions.
Febrile convulsions are caused by high fever and can occur if an infant or child experiences a rapid rise in body temperature. A fever emergency occurs when an infant's temperature is 38 degrees Celsius or higher, and when a child's temperature is 40 degrees Celsius or higher.
Signs and symptoms of febrile convulsions: sudden loss of consciousness, sudden uncontrollable shaking, irregular breathing, drooling from the mouth, loss of bladder control.
Febrile convulsions can be prevented by controlling a child's temperature before it rises too high. If a child develops a high fever, advise the parent or childcare provider to call the doctor and follow their directions. Encourage the infant or child to drink fluids. If the doctor cannot be reached, advise the parent or guardian to give acetaminophen such as Tylenol, Tempra, or children's ibuprofen. Do not give ASA or aspirin.
If the fever remains the same, sponge the child with lukewarm water for about 20 minutes. Do not use cold water, as this may shock the child and cause more serious problems. Do not immerse the child or infant in a tub of water. The temperature will go down more quickly if the child's wet skin is exposed to air.
If the child has a convulsion, call for medical help right away. Do not restrain the child. Clear away objects and protect the head. Loosen any constrictive clothing at the neck and chest. When the convulsion stops, clear the mouth and nose and place the child into the recovery position. For an infant, hold them face down with the head lower than the body.
Environmental emergencies.
There are many different types of injuries that can occur due to the environment. Exposure to extreme temperatures, whether hot or cold, can damage skin tissue and cause body systems and vital organs to shut down. We will now examine different types of environmental emergencies, such as heat emergencies, hypothermia, and frostbite.
Frostbite.
Frostbite is the freezing of body tissues and is a type of cold emergency that affects specific body parts. Depending on the circumstances and time of exposure, frostbite may occur by itself or along with hypothermia.
Frostbite can occur in body parts that are exposed to extreme cold. The water in the skin freezes and swells, causing cells to die. Deep frostbite can lead to the loss of body parts.
Signs and symptoms of frostbite. Loss of feeling in the affected area. Skin appearing waxy. Skin that feels cold to the touch. Discolored skin ranging from white, yellow, or blue. Frostbite may occur by itself or along with hypothermia. First aid for frostbite.
Gradually warm the body part by gently immersing the affected area in warm water until it appears and feels normal. Place gauze or cotton between the fingers and toes. Bandage the area with dry, sterile dressings. And see a doctor.
Hypothermia.
Hypothermia is the general cooling of the body. Air temperature, humidity, time of exposure, wet skin, and wind chill are all factors that can contribute to hypothermia.
Hypothermia is caused by exposure to the cold to the degree that the body cannot keep itself warm. In hypothermia, body temperature drops below 35 degrees Celsius or 95 degrees Fahrenheit. As the person gets colder, the heart begins to beat irregularly and eventually stops.
Signs and symptoms of severe hypothermia. Person has stopped shivering. Numbness. Confused or unusual behavior. Body temperature below 30 degrees Celsius or 86 degrees Fahrenheit. Body that feels stiff. Breathing that has slowed down or stopped. First aid for hypothermia.
Change the person's clothing only if necessary and have them sit near a heat source, like a fireplace or a stove. Give warm liquids if the person is alert, preferably non-alcoholic and decaffeinated drinks. Wrap the person in blankets or heat pads. Do not warm too quickly as it can cause heart problems.
Heat emergencies. Did you know? Normal body temperature is 37 degrees Celsius or 98.6 degrees Fahrenheit.
Heat emergencies can arise when there is prolonged exposure to extreme heat or intense physical exertion in a hot or poorly ventilated environment. Valuable fluids are lost due to excessive sweating, and circulation is affected due to the increased blood flow to the skin and away from vital organs. Heat emergencies can worsen rapidly once they appear. Providing first aid upon spotting the initial signs of a heat-related illness could prevent it from becoming life-threatening.
Heat emergencies such as heat cramps, heat exhaustion, and heat stroke can arise when the body cannot manage extreme heat. Valuable fluids are lost due to excess sweating, and increased blood flow to the skin causes a lack of proper blood flow to the vital organs.
Heat cramps.
Heat cramps are painful muscle spasms caused by fluid and salt loss. It can result from strenuous work or exercise in warm temperatures. Have the person rest and stretch and massage the affected area. Give the person cool liquids that do not contain alcohol or caffeine. Sports drinks are highly recommended.
Heat exhaustion.
Heat exhaustion is more serious than heat cramps, and is the most common heat illness. It results from fluid loss due to work, exercise, excessive sweating, and overexposure to warm or humid conditions.
Signs and symptoms of heat exhaustion: normal or slightly raised body temperature, moist skin, skin that appears red or pale, nausea, dizziness and weakness, exhaustion. To prevent heat exhaustion, drink plenty of fluids, dress appropriately for heat and activity levels, and take frequent breaks in a cool or shaded area.
Heat stroke.
Heat stroke can arise if the signs and symptoms of heat exhaustion are ignored. Unable to cool itself, the body's temperature rises to a degree where the brain and other vital organs cease to function properly.
Signs and symptoms of heat stroke: high body temperature, red, hot, dry skin, sweating has stopped, irritable or aggressive behavior, progressive loss of consciousness, rapid, weak, or irregular pulse, rapid, shallow breathing.
First aid for heat stroke. If possible, immersion in cold water is the initial recommended treatment of heat stroke.
Move the person away from the heat and give them cool water to drink. Remove sweat-soaked clothing. Pour cool water on the skin, especially around the head and neck. Fan the person to increase evaporation, to remove more heat out of the skin. If level of consciousness changes, call 911. To further cool the body, use wet sponges or ice packs. Place cold packs on the groin, in each armpit, and on the neck to cool the large blood vessels.
Poisons. A poison is any substance that can cause injury, illness, or death when it enters the body. Ingested poisons.
Ingested poisons are swallowed or come into contact with the mouth or lips. Some examples include medications, cleaning products, and pesticides. Call the poison center and follow their directions. Induce vomiting or dilute the poison in the stomach with water only if instructed by the poison center.
Inhaled poisons.
Inhaled poisons are breathed into the lungs. These include carbon monoxide from car exhaust and fumes from solvents, paints, and industrial products. Provide oxygen for the person as soon as possible. If it is safe, remove the person from the area to provide them with fresh air.
Absorbed poisons.
Absorbed poisons enter the body through contact with the skin. Plants, such as poison ivy, and the chemicals used in gardening products are common sources. For poison plant contact, wash affected area with soap and water. Remove any contaminated clothing. For contact with wet or dry chemicals, call the poison center and follow their instructions.
Injected poisons.
Insect stings are common examples of injected poisons. Bees and wasps can leave a stinger in the wound. If the stinger is still in the skin, remove it by scraping it away. Do not use tweezers, as this may squeeze more poison into the skin. Wash the area with soap and water and cover it with a sterile dressing. Put a cold pack over the area to reduce pain and swelling. Be sure to watch for signs of an allergic reaction.
Thank you for watching First Response, the complete guide to first aid. Remember, this video is not a substitute for live training, and it is recommended to contact a local first aid CPR training company. For more information on courses in the Greater Toronto Area, please visit heart2heartcpr.com.